name's Debbie. I live in North Olmsted with my husband Mark. I have a 13-year-old son who has autism and type 1 diabetes, and I just think that respite is an incredible need for families who are raising a child with disabilities. It really does take a lot of stress, off of families. I have a son who is now 13, and he has autism spectrum disorder, and he also has type 1 diabetes. And with type 1 diabetes and autism, it's tricky because the autism, he really has trouble connecting his feelings. And for those of you that have diabetes, you know that you really have to be connected with your feelings to be able to feel your highs and your low blood sugars so that you can either get insulin or eat something to bring your blood sugar up. So with him, it's very difficult for him to be able to measure that his blood sugar is high or it's low, and it can be dangerous in a lot of situations. So he has to have someone with him basically 24/7. We probably began pursuing respite care early on with my son, especially after he acquired the type 1 diabetes, which was around the age of 8 for him. And it was just difficult for us to be around him 24/7. Although he was at school for a part of the day, he wasn't, he had time after school on the weekends where a parent basically had to be with him, or someone that knew, quite a bit about type 1 diabetes. And that's when we figured out that, a normal babysitter, so to speak, or even a family member, it was even difficult for them to care for him because the medical needs were so extensive. And our situation seems to be somewhat unique in that, there are respite providers out there, but we need a respite provider basically that can provide nursing services because of the insulin injections, and then also just recognizing signs of low and high diabetes. And what we found was those services aren't readily available for children, and if you can find them, they're quite expensive. You basically need to have a lot of financial resources in order to have any extensive type of respite care is what we discovered. Difficult. Most of the organizations don't have that type of respite. They have trained people that do respite, and they may have some nursing services, but not to the extent that they felt that our child would need. Most of the barriers, like I said, had to do with people not wanting to really assume liability. The other barrier is you can find a nurse that understands type 1 diabetes, but then try to find a nurse that understands autism and type 1 diabetes. That is almost impossible. We're a pretty stressed out family. My husband and I, we go to events. One stays home and the other one goes, whether it be family weddings or family functions, where it's an adult only type of situation, or even just trying to get normal everyday chores done. It'd be nice to have someone that could care for our child while we actually take care of our everyday needs. And it's hard. It's hard for us. I don't think that we've spent 2 hours really together alone, in a long time. It's created quite a stress on the family, quite a stress on relationships in the family. But it would be nice. It would be great actually if we could have some sort of alternative so that we could do these everyday things and even be able to go to family functions or events in the community without having to worry that something's going to happen. I know there are communities that are better than others at providing services for young children. Hopefully, families don't have a situation like ours where you have significant medical needs and then you have also a child that has a hard time communicating what those needs are. But if you do, I would recommend you just hang in there and keep looking and keep hoping that the situation improves.
My mother lived with us now. She's been with us for about a year and a half now. We had went down south to visit back in April of last year, and we found in condition that wasn't suitable. And at the time we realized, after taking her to the doctor, we realized that she was unable to live by herself at that time. So we made a decision to move her in, bring her up with us to live. My wife talked to our doctor at the time, which was Dr. Anderson, and he recommended Benjamin Rose. He said they had a very good program. He said that they had a lot of activities to offer that also helped the caregivers, because he explained to us that being a caregiver is going to take a toll on both of us. So it's been very helpful. Well, basically she can do things on her own as far as taking care of her hygiene. It's just that she cannot remember to take her medication. We don't trust her around using stoves, something like that, because there have been times when she went to make some tea, left the pot on. So other than that, dementia still maybe in the middle stage, so she has to be watched. We can leave her for a while, but we don't feel comfortable with it. She go to the adult care program down at Benjamin Rose on Euclid Heights Boulevard, and also we have a companion come in twice a week, which is a big help. Matter of fact, she's there now with my mother while I'm here. Well, basically, it gives me time to recharge, time to shop. My wife, I had to change shift. I'm working out from 5 in the evening to 1 in the morning, and my wife works during the day. So we had to alter our life to help my mother out. So by having this available for us, it gives me time to rest sometimes, time to shop, just a break from it. Because when you're taking care of an elderly person, it do drain you. Mm-hmm. It wears on you. Mm-hmm. So it gives me that time. Sometimes I just sleep, and there's times when I have to just go over the house. I'm behind in projects that I normally would be way ahead on, but it's time consuming. So it gives me some time for myself, just to regroup. I give her some activities. She liked going down there, socializing with the other people down there. She had made some friends since she's been there. Some of them she liked to go visit, but they just communicate. I think that, from my own personal experience, you have to get affiliated with an institution like Benjamin Rose to assist you, because there are people that we have talked to, I would say over the about the last month, that don't have anybody, and they talked about being burned out. But you need to have someone or somebody to help you in that situation. Whatever condition your loved one is in, you got to accept the fact they're not going to get any better. But my mother, dementia is going to get worse. Her dependency on us is going to become more. So those are things, it's not what you call a bright future to look forward to. So if you don't have anybody to give you any support, you would end up yourself being hospitalized or either just totally drained out. So that's the advantage of it. I think they should contact someone. When you become a caregiver, you have no idea what you get ready to accomplish until you actually start. And that's why I just feel that anybody who's going to take on that responsibility, it's important that they contact an institution like Benjamin Rose or some institution that's going to give them some advice and some assistance during that time, because that can lead to other things.
My name is Sabrina Heath, and I live in the Shaker Heights area. I'm single, no husband, no children, but I do have a dog named Zola. And I was a caregiver for my mom. She had Alzheimer's disease, originally diagnosed in 2000. And she just recently passed away in January of 2011, just this past January. But I was her primary caregiver during that time, and then I also had home health aides that came in and helped me. In fact, I call them my angels because I wouldn't have been able to do it without them. I basically, from 2000, she was diagnosed with Alzheimer's disease, and then about 2003, she got up in the middle of the night, took a wrong turn, and took a tumble down the stairs, broke her shoulder blade, and at that point, the Alzheimer's really accelerated. So at that point, I needed home health to be in on a regular, full-time basis. I took care of her in the evening, and then I also tried to use whatever services I could find to help with her care. It was through the Alzheimer's Association, which is a wonderful, wonderful support program. They told me about the Caregiver Respite Program, and so I was also helping my aunt to take care of my mother's brother who had stomach cancer in Birmingham. So I kind of stepped up and helped my aunt, and that's when I first started using the respite program. Actually, we had to get his financial affairs in order, so I actually had to go down to Birmingham to help with getting his affairs in order. And so I was able to have respite come in and have overnight, because usually I had home health aides, but I could not afford them to stay overnight, and that's where the respite supplemented. And then also in 2008, I was diagnosed with breast cancer, and I had to have a lumpectomy, chemotherapy, radiation, and I would have respite come in. I would use the respite services whenever I had chemotherapy because I was very fatigued and I couldn't lift her, and so it was a wonderful, wonderful resource for me. Yes, it was very affordable. We paid some through my mom's out of her check, but then we also supplemented with the respite care. And to be honest with you, I don't know how I would have done it if I did not have that option available to me. Yes, well, it afforded me to have someone come in the evening, because normally I would have to, the ladies would be there, my home health aides would be there during the day while I worked, and then when I came home, I would have to take care of her in the evening. So by having me being able to pay my home health aides to come in and take care of her at night, that helped me quite a bit. So it not only helped my mom, but it helped me also. Well, I probably would have had to call on friends and family. Don't really like to do that, and a lot of times they're busy with their own lives. So it would have been quite a challenge, or I probably just couldn't do what I needed to do. I just would have had to stay there and take care of my mom and not have the option of being able to go and take care of other issues that I was involved with. It's a very, very challenging journey. I tell everyone that. It's extremely overwhelming. I really think you need to find some kind of support group, number one, because it's going to be just very challenging, and especially with someone with dementia. As the years progress, the dementia progresses also, and so they have different behavior changes. Like with my mom, she was extremely combative. And so that's why I did not want to put her in a nursing home. because I knew they would only just medicate her, or either some physical altercation would happen. So that's why I decided to have her at home with me. So you definitely need support services. If you're treating someone, or if you're caring for someone that has Alzheimer's, I would definitely look into other support services like the Alzheimer's Association, like the Respite Caregiver Program, and also to call on your family and friends, because they know what you're going through. And a lot of times to see if they can donate some time to help you as well. Just that it's a wonderful resource. A lot of times people don't know there's support services out there. When you're a caregiver, a lot of times you're very isolated because you can't get out. You can't really talk with other people about your situation. So it's nice if you can actually find family and friends that can help you with that, so you can talk with them.